But we begin tonight with exclusive research from North West Tonight, which has revealed that hundreds of seriously ill mental health patients are stuck in accident and emergency departments across Lancashire, sometimes for days, because there's nowhere else for them to go.
The county's mental health trust, Lancashire Care, says it's working to resolve the issue, but some experts say progress is not quick enough. Our health correspondent Gill Dummigan is here now with more. Gill.
When mental health patients are in crisis, they often end up at a general hospital A&E. From there, they're supposed to be assessed by a suitable specialist and then either admitted to a mental health hospital or get some other help. But in Lancashire, the Mental Health Trust, which does that, Lancashire Care, can't keep up with demand, and so people aren't being assessed quickly enough, and the situation is getting worse. 3 years ago, the total number of mental health patients waiting more than 12 hours in Lancashire's 4 main A&Es was 68. A year later, it was 139. And in the 9 months to December, it was 379. And some of these patients are there for days. The longest wait, in fact, was 5.5 days. And that has a huge impact on the patients and the hospitals too. In Bispham, we meet Stuart. His partner has an ongoing mental health condition which sometimes tips into crisis.
We've been to A&E probably a dozen times over the last 3 or 4 years.
Stuart's trips to A&E are often in the evening, and that, he says, means a long wait for help.
If you go in sort of after 5 o'clock, generally you know you're going to be there till the morning, till you're assessed. She very rarely leaves the house, so to be put into that environment and then having to wait there with all the activity that goes on in the A&E unit, it's frightening for her.
Stuart and his partner go to Blackpool, Victoria, where since April 2018 there have been 158 occasions when mental health patients had to wait longer than 12 hours to be properly treated. 2 years ago there were none, and the problem is Lancashire-wide. This is the Royal Blackburn, East Lancashire's main hospital. In the 12 months between April 2016 and March 2017, the number of mental health patients who had to wait more than 12 hours to be admitted for the treatment they needed was 43. In the 9 months since last April, that number has gone up fivefold to 219. And some of those waits weren't just hours. The longest here this year was 4.5 days. But the people in this hospital and at Blackpool have no ability to change this. They're reliant on the Specialist Mental Health Trust coming up with a bed in one of their own facilities. And until they do, that patient has to stay here.
It is causing that degree of challenge in the system, there's no doubt about that.
The Trust has introduced specialised training for staff to make sure the patients are safe and properly cared for, but it's far from ideal.
There's added requirements for staffing because we'll usually supply one-to-one members of staff for such patients. And of course, in all the time that they stay in our general emergency department, the cubicle is occupied for that period of time.
So that's a lot of pressure on an already pressurised department.
So it is putting added pressure onto a pressurised department, yes.
Mental health provision for the whole of Lancashire is run by the Lancashire Care Trust, who admit there's a problem.
Absolutely. We have far too many people waiting far too long to access our services, so we do recognise that.
And why is it happening?
There's two main reasons. One is increased demand.
That's because the number of people having a mental health crisis have gone up sharply in Lancashire over the past year. Blackpool Council's one of the many organisations which wants to know why. So last week they called a special meeting with Lancashire Care.
There seems to be a real sense of urgency and an understanding of the crisis and the suffering that people are going through.
I don't think we really got to the bottom of what they're going to do about the numbers of people being referred to A&E, and then the incredible amount of time people are spending there.
For me, it's a symptom of what's not happening in the community. So really, we need to get the right support, the right crisis support for people out in the community, and unfortunately, that's not being provided at this moment in time.
The organisation responsible for that community provision is, again, Lancashire Care.
So we take this quite urgently, and we're trying everything we can within our resources, but then with our partners in the acute, the commissioners, local authorities and the third sector, we'll look to see what else we can do. We know that our community teams are good, but we need to enhance them. We need to make sure that we're fully utilising the third sector. These are things we need to improve on, and we recognise that.
An independent report into the situation is due to be published in the coming weeks. Stuart, meanwhile, is campaigning for a change in the system.
We're hoping that we can somehow develop an alternative for people. You realise that the situation for so many people in A&E isn't appropriate. It's not the appropriate place.
Gill Dummigan, BBC North West Tonight, Lancashire.